to be able to understand. And we do have a specialist in the house today. We will be introducing him shortly. And we have somebody else who will be coming on to talk about health and wellness. So yes, Saffron SACAP, Saffron Safeguarding the African Child and Adult Partnership. We are very versatile. We cover from A to Z, and what we would love to hear from those of you who are on our pages, our social media handles, please, please, please tell us what you would like us to cover on the show. As a director for programs, it is my job to read those requests and do something about it with my team. And I've got such a formidable team, and we will look at those issues. We will research, we will dig out the best people possible that can come on here and answer your questions. If you want it done anonymously, we will also, comply with that request. Okay, so nothing is too sensitive, nothing is too PC. We will handle it, we will deal with it. Our job is to bridge the gap within the community, and that's what we do. And we hope, we really hope we are making and creating an impact out there. And please feel free to tell us when we are not, because the only way we can get better is when you tell us what you want to hear, tell us what we're doing that might need to be done better. Nobody is above criticism. All right. So thank you, those of you who have joined us today. Thank you, Facebook family who have joined us. Please share, share, share. We will be starting very shortly. I'm just going to hand over now to Yemi to do the introductions, and we will kick off.
Really?
Over to you, Yemi. Yes.
Okay. Those are thinking I'm just going to sit down and just be quiet today. So now I've got my false glasses and I can see you all.
Just try.
That's all right. The show must go on. Welcome, everyone. Thank you so much for joining us. It's a lovely, lovely day. I really don't care what you think it is outside. It is what you make it. And I believe it's a lovely day. It's a good day. Many people are not able to sit down and laugh and communicate like we are. So we give God all the glory for that. We had a lot of questions that came to us with regards to underlying ailments within COVID times, and we just put it COVID times because pandemic, whatever anyone's calling it, it is a time that we're in, and we're going to a time that we will leave behind. Grace of God, it has come and it will pass. But within these times, there are a lot of people who have been, who are falling short of COVID, and also more so because they have underlying ailments which then aggravate this disease and puts them on the back foot. Some of those are people who suffer from asthma, people who suffer from diabetes, and people who suffer from cancer, people who high blood pressure. And one that was identified, which is quite prominent in our communities, Black African communities, it's sickle cell. Sickle cell anemia, it's called, or sickle cell disorder. See, we have our designated nurse on the program as well. So please, Auntie Vicky, if I miss those phrases, pardon me, and our doctor in the house as well. I'm only a safeguarding consultant. What do I know? Today we really want to welcome Dr. Oweye, Dr. David Oweye. He is a specialist. Did I get that right? He's a specialist on this topic, safeguarding sickle cell. And do you know what? best for me to leave him to introduce himself. There is no way I could do this man justice, because I have read, I've gone and I've looked, we've researched him out, and he is he has a book out as well, which he's going to talk about. But yes, this is his floor today, and so we'd love to welcome you and say thank you for joining us. Thank you for accepting our invitation. All the way from Saudi Arabia. I still can't get over that, but hey, it is great to have you on board. You're very welcome. Please, the floor is yours, Doctor. Hello. Be nice to see your face, hopefully. Is he still
We
here?
might be having connection issues. Okay, Doctor, are you back? Okay.
Yeah, I'm back. I'm back.
Okay, we have just opened the floor for you. So if you
Okay.
could put the video on, and yes, the floor is yours. Thank you.
I'm going to start by sharing your page, but if you can talk and let us know more about yourself first, please, that'd be great.
Okay, Doctor, the floor is yours. Yeah, it looks like he's frozen. We're just going to give him a few minutes, because obviously he is speaking in from Saudi Arabia. So we have to just give him some time to sort out the communication issues there.
Okay, I'll pull this down temporarily.
Hello, sorry. I think the internet is a bit messy tonight, but it's unusual, but we'll make do with what we have.
Absolutely.
Okay, so do I start now?
Yes, please.
Tell us about yourself first. Give us some introduction about yourself. Let's know more about you, what you do, what you specialize in, and then you can start. Take your time.
Okay, my name is David Oweye. I'm a medical doctor. I specialize in infection prevention and control. And I'm a sickle cell warrior. Preferably now, the world try to use the word sickle cell warrior rather than using sickle cell patient. My own genotype, hemoglobin genotype is SS. So categorically sickle cell warrior. In the course of the lecture, or in the course of the presentation, I'll talk more about it. I'm a Nigerian. I work in Saudi Arabia, the Ministry of Health, work in infection prevention and control. I'm married with 2 children. Okay, is that okay?
Yes, that's great. Thank you.
That's great.
Thank you very much.
Okay.
So would you want me to start the slides now?
Okay, no problem.
Okay. Where are we?
Okay, so I will try as much as possible to communicate without going into so much of medical jargons, so that the public can benefit from whatever we have to say tonight. As the first slide you can see, it's about sickle cell disorder. And then the word disorder, based on the fact that there are different types of variants, disease, traits, and so many. So the word disorder tends to be more encapsulating of the different types. So at times you could see people interchange the word disorder with disease. But from other medical literature, they've been able to distinguish that the disorder encapsulates everything, the trait, the disease, and many other things. Okay, the next slide, please.
Okay, sir.
And I will try as much as possible to communicate with my own experience and the experience of other sickle cell warriors so that people could relate with what we have to say about sickle cell. Because from my understanding and reading about sickle cell from literatures globally, there has not been much research into sickle cell because most of the time sickle cell warriors don't talk or don't speak out about it. So there is little, so some things about sickle cell, there are little information you get from the medical journal about it, except you get to talk to sickle cell warriors. So that is one of the reasons why we emphasize that it's very important sickle cell warriors start talking about it to people so that it could help to engage in more qualitative research about sickle cell. So what is sickle cell disorder? Sickle cell disorder is a genetic blood disorder known as hemoglobinopathy. Now, hemoglobinopathy is definitely defined as diseases of the hemoglobin, on which sickle cell is part of it, thalassemia is part of it, and some others. It is a disorder that is inherited by birth and is expressed based on the gene the child inherits from both parents. So it is not inherited as transmission like communicable disease. It is a non-communicable disease because you don't need to be bitten by an insect. You don't need to touch someone like COVID-19, cough, or you don't need to spit or laugh for somebody to inhale it. It's not transmitted through an organism, a germ. It is rather transmitted by birth when a parent contributes one of the gene that is mutated, that is abnormal, and the child picks it from each of the parent. That is how it is transmitted. So that's why it is classified a non-communicable disease. The problem is with the structure of hemoglobin in the red blood cell. That hemoglobin is that part of the red blood cell that carries oxygen and makes it red. That's why it's given the name red blood cell. So that part of the red blood cell that carries oxygen is hemoglobin. The blood cells are three types, basically: the red blood cells, the white blood cells, and then the platelets. Red blood cells is basically for transportation, mainly for transportation. White blood cells are more of immunity, fighting cells, and then the platelets are to arrest bleeding. So for sickle cell disorder, it is the red blood cell that is affected. Okay, the next slide, ma'am. So what are the variants? As I said earlier, people now use, medical literature now try to use disorder rather than disease because it tends to encapsulate every other variants under it. So what are the variants of sickle cell disorder? By talking about the variants, it's better to let us understand how it is diagnosed, what test is done, hemoglobin electrophoresis, or high performance liquid chromatography. That is for more of scientific issues. So for anyone that wants to know whether he or she is sickle cell anemic, the test to do is hemoglobin electrophoresis. Not red blood cell test, not white blood cell test, those ones are good. If you do total complete white blood cell count or whole blood. Hello, sorry for the interruption. I think you just have to. Okay, so if you do complete blood count, it may show you that the red blood cell for sickle cell anemic or sickle cell warriors may show you that the red blood cell count is low. But to be able to know whether the person has sickle cell or not, it is hemoglobin electrophoresis. And then hemoglobin electrophoresis will help you classify which type, know which type, based on what components of the hemoglobin gene are affected. So that is a test that helps you to be able to make a diagnosis of sickle cell. Now, there are different variants of sickle cell disorder. First, there is sickle cell trait, which is the AS or AC. Now, for most of the time, we know about the hemoglobin S, sickle cell anemia. But there's also C, which is also an abnormal, produced by an abnormal gene in the hemoglobin. So from those, you could hear people having AC or as long as there is an A attached to the S or C, the person is a carrier, which is like a trait. So that person, whenever he or she marries and needs to give birth to a child, contributes either the A and the S, or either the A or the C. Now, sickle cell disease is for SS or SC. The worst between the two is SS, or basically the worst in all 4 variants of sickle cell disorder. Medically speaking, is SS. So SC tends to be milder form of SS, but it is also a disease that has its own variants of symptoms, various symptoms and then presentations with it. Then there is beta thalassemia trait combined with sickle cell disease. So that sickle cell disease could be either the ASS or SS. There's also beta thalassemia disease combined with sickle cell disease. Now, the beta thalassemia trait is just like sickle cell trait, whereby the person has an A and then the abnormal beta thalassemia. But we're going to be focusing more on the sickle cell disease and the trait. And then there are other rare forms like the D Punjab, O Harab, and E, and the rest. There are some others that I did not list because there are little information or little literature about them. There is still more research going on about it. So these are just the variants of sickle cell that we can know. When we get to read more, we'll understand more about it. But we'll try and focus more on the AS, AC, the trait, and then sickle cell disease, SC, SS. Next slide. Okay, so let me just take us through the history lane for sickle cell disorder. When did it emanate? Unscientifically, that is not documented, it was discovered in a Ghanaian family in 1670. Now, further on in life, it's from medical literature that children that are classified in those days, in the 80s, 90s as Ogbanje, could be sickle cell. Because, you know, if you are from the tribe, Yoruba tribe that knows about Ogbanje, you know, most of those children that they classified as Ogbanje is because at a particular age they die. At a certain age, they don't get to a certain age before they die. Now, when I was growing up, I had people telling me that, oh, because you are sickle cell, you cannot live up to 18. Once you are before 18, you die. Now, for that Ogbanje issue, that was also something similar. So it's like researchers have to be able to think retrospectively and say, oh, maybe, or there's a high chance that those people that were classified as Ogbanje are sickle cell, because there is a particular age that they do not reach. Now, you know, there was little information about medicine in those days. You could not make a diagnosis because of lack of tests and other things and care. So it is difficult to be able to ascertain. But from looking at the history of those people and classical presentation, made them come to the conclusion from medical literature that, oh, possibly those people were Ogbanje because there is a cap of the age they can reach. And after that period, they die. And then, you know, this addendum, they had to eat that, okay, when another child comes and also die at that particular age, they think it is that same child that is coming again. Mm-hmm. But possibly it could just be that the parents are either both carriers or the parents are sickle cell and they keep giving birth to sickle cell. And because the child does not receive adequate care, at that particular age, the child dies. They give birth to another child, at that particular age, the child dies. So they just give the assumption that maybe it's that child that is coming back again. Not knowing that it's different children that are having the same problem. And because there was no adequate care to be able to attend to them properly, they keep dying at that particular age. Now, scientifically, the first identification was in 1904 by a Black Negro called Walter Clement Noel. He came from Canada Highlands and he was studying dentistry in the University of Chicago. And then he was admitted into the Chicago Presbyterian Hospital. He was the first to be identified scientifically that he has sickle cell. In fact, there was this classical write-up about him that under microscopic examination, the doctor that was attending to him saw that his blood cells contained crescent-shaped red blood cells. Some other describes as oblongated. But that crescent-shaped or sickle-shaped, that was when they understood it that, oh, his blood cells were abnormal compared to what they've been seeing from other people. And so it was like the first person that brought it to the attention of the medical community scientifically. So the doctor that published his finding based on what he saw from Water Climate Noel is Dr. James Eric. In fact, initially he named it Eric anemia, but later on they had to change the name to sickle cell anemia because of the nature of the red blood cell when it is sickled. And it was published first in the archives of the internal medicine. So that's just a bit of history. There is still other aspect of history about sickle cell. In fact, one aspect of history about sickle cell is that within the early 19th century, I think 1950, sickle cell was the first to be classified as a metabolic disorder based on some scientists. Some scientists also discovered that, differentiated sickle cell disease from the traits. And so there are so many information about the history of sickle cell that we could get online, but I just brought out some of these few so that we could be able to have a brief understanding of sickle cell under the limited time we'll be talking. Okay, next slide now. So what is the problem with sickle cell disorder? As I said, it is the hemoglobin. Hemoglobin is into two components, Heme and globulin. Globin. Now, Heme is the red part that carries oxygen. And then Heme that's where you find iron. Now, the globulin is divided into two, has two chains, alpha chain, beta chains. For sickle cell disorder, the problem always with the beta chain. And there is a mutation in the beta chain that affects production of the red blood cell within the bone marrows. That mutation affects production of amino acids. So for sickle cell hemoglobin SS, the abnormality is on the 6th position of the beta chain, whereby a particular amino acid, glutamine, is exchanged for valine. So that is where the disorder happens. For other types, it's also on beta, this position of beta chain, but it could be the abnormality with other amino acid. But for sickle cell SS, the abnormality is with amino acid that is produced on the 6th position of the beta chain. Instead of producing the glutamine, it produces valine. And so it gives you that abnormal shape when it's exposed to certain conditions. Now, the point is this, all blood cells, most of them are produced from the bone marrows. So transfusing somebody with clean blood, as some people would try to call it, or transfusing somebody with the blood of somebody that's not sickle cell, does not eradicate or does not stop sickle cell. Because the problem is with the production. The person that is sickle cell anemic is producing abnormal red blood cells within the bone marrows. So whenever there's a deficiency of blood cells, maybe due to infection, trauma, or whatever condition that is making the person lose blood cells, and the hormones in the body informs the higher centers that there needs to be production of blood cells. The red blood cells are produced from the bone marrow. And because there is a problem with production of red blood cells, at that particular position, it will still produce that abnormal gene. Now, the point is this, it will not show the sickle cell, or it will not come out from the bone marrow as a sickle cell. But under certain conditions, the red blood cell becomes abnormal. Ideally, the structure of the red blood cell is biconcave. But for somebody that is sickle cell anemic, when they are exposed to certain conditions, which are called triggers, then the red blood cell, which is biconcave, now gets distorted and becomes sickle shape. So those conditions are what we will talk on from the next slide. Now, just know this, red blood cells transport oxygen and other nutrients. So once this structure of the red blood cells, which is biconcave, becomes sickle, it blocks the blood vessels, either the small arteries, the medium arteries or intermediary arteries, and then the big vessels. It blocks all of them. So once it blocks it, blood will not be able to flow appropriately. So what is supposed to happen when blood flows appropriately is that the red blood cells will transport oxygen and other nutrients to different cells and organs in the body, and then the waste generated from those cells and organs, they transport it to the kidney or the intestine where they are expired or where they are secreted out. But because there is blockage in the red blood cells, it will not be able to transport oxygen and nutrients needed to the different cells, tissues, and organs, and it will not be able to take away the waste products within that period, within those places. So most of the problem that occurs from sickle cell anemia is because of that blockage. Now those cells, tissues, organs are starved of oxygen and other nutrients. Once cells are starved of oxygen and other nutrients, they can die or they can function abnormally. And it also affects the organ. So once you just understand that, it will help you know that every organ in the body is affected for sickle cell. Sickle cell affects every organ in the body because every organ in the body depends on blood, and then there are blood vessels within. So look at the eyes, it is affected. The brain, it is affected. The legs, the liver, the spleen, every organ, the lungs, every organ in the body is affected as long as they depend on blood. So once blood is blocked because of a sickled red blood cell, the nutrient that should get to those cells or organs are prevented, and then different things start manifesting. So let us go to the next slide so I can briefly talk about those triggers that cause the red blood cells. Okay, so let me quickly just talk about this, how it is inherited. The T is for trait, N is for normal, and then S is for sickle cell. So let us go to my left-hand side where you have the father that is, please, can you move it down a bit? I want us to see the father. I think the father is the trait, father is a trait, mother is the normal. So what happens is that for trait will be AS or AC, normal will be AA. So the father will give 1A and then 1S, while the mother can give either A's because the mother has 2 A's, so she's giving A and A for each pregnancy. So we are using an illustration of 4 children, but I'm going to explain later. It's not about 4 children. For what happens when trait and normal marry and then they give birth to children, because the father gives S and then gives A, they will have 2 traits. The father will give A, the father will give S. So when a child has AS from the father, 1A from mother, S from father, they will have 2 traits and then 2 normal. Now the illustration is with 4 children, but it's not 4 children. This is how it is illustrated. Now you see this diagram that shows 2 traits and then 2 normal. It is for each pregnancy. So what we are looking at, because we have 4, we are going to use it to represent 100%. 1/4 is 25%. So this is how it works, because most people don't understand. Some people don't understand it at this point. So I need to explain it properly. Some people think when you're explaining this, like traits and normal coming together and giving birth, that out of 4 children, 2 will be traits, 2 will be normal. No, that's not what it means. What it means is this: for each pregnancy, there's a 50% chance that each pregnancy will be a trait, and there's a 50% chance that each pregnancy will be normal. So let us move to where we have sickle cell and normal. Okay, the one below is shows sickle cell and normal. This one I want to use to explain properly. Sickle cell and normal. No. Sickle cell and, okay, sickle cell and trait. Yeah, sorry, sickle cell and trait. For sickle cell and normal, what they will do is, what will happen, because the father has SS, the mother has normal, the father can only give S. So all the child they will have is trait. Mother is giving A, father is giving S. So the child will have A, and then A from mother, S from father. So it will be AS, AS, AS. All children will be AS. So even if they're having 19 children, all the children will be AS. Now let us look at sickle cell with trait. Those are the ones that should not marry once you understand this structure properly and this diagram. Sickle cell with trait, there will be two traits, and then, no, this is wrong. Sorry, this is wrong. It should be 2 traits, 2 traits, 1 normal AA, and then 1 SS. And I'm going to explain like this. I hope you understand it. Where it shows sickle cell with trait on my right-hand side, it shows 2 traits and then 2 SS, sickle cell. It is wrong. It should be 2 traits, 1 sickle cell, and 1 A, and 1. No, it should be 2 traits, okay? 1 sickle cell, 1 A. No, this is correct. This is correct. I'm trying to look for another one. Oh, okay. It's not shown in this diagram. But I just want to explain, when you have traits coming together. Okay, yeah, that's the one above. Traits coming together. The one above, the one I was talking about. Traits coming together. You will have 2 traits and then 1 sickle cell, 1 normal. Now I'm going to explain it. As I said, it is not 4 children. It is per pregnancy. So what will happen is for each pregnancy, there is a 50% chance that it will be trait, sickle cell trait. For each pregnancy, there's a 25% chance that it will be sickle cell. And for each pregnancy, there's a 25% chance that it will be normal. So that is how you interpret it for all of them. And that is how you can advise people about marriage. Once you know that trait will produce, there's a 50% chance of trait, 25% chance of sickle cell, you advise them there is no point marrying. Because now I've seen or I've heard of parents that are trait and all their 3 children are sickle cell because it is by chance, and you can't predict chance. So unfortunately, each pregnancy picks the 25% chance of sickle cell. And I've seen parents whereby each one of them are trait and all their children are normal because each pregnancy was fortunate to pick the 25% chance of normal. And I've also seen trait whereby each child, maybe they had 2 sickle cell, they had 2 traits because unfortunately, each pregnancy of 2 children picked sickle cell and each pregnancy of 2 children picked trait. So that is how it is explained. It is based on percentage for each pregnancy, not for 4 pregnancy or 4 children. So it could be unfortunate for some people that if trait marries, all the children could be sickle cell because the chances of 25% is what picks on each child, of 25% sickle cell. And it could be fortunate for some that all the children are normal because the 25% chances fell on normal children. So the best advice, because we cannot predict chance, is for trait, you don't marry each other. For trait and normal, because they can give back to only trait and normal, but not sickle cell, you can advise them to marry. For sickle cell and normal, they give back to trait, so you can advise them to marry. Sickle cell and normal, that will be father or mother is SS, and father and mother is AA. For sickle cell and trait, they can't marry because they will give back to sickle cell. So the one on the right are the ones that cannot marry because they will give back to children with sickle cell. And each pregnancy can unfortunately pick the chance of sickle cell. And the ones on the left are the ones that can marry. Trait and normal can marry, sickle cell and normal can marry. So I hope this is clear.
Yes.
Because that is where people make that mistake, even some sickle cell and even some medical practitioner, that it is not about 4 children, it is about each child and chances. So unfortunately for some, the chances could be, if they have 5 children, all of them are sickle cell, if it is trait that marries, or all of them will be normal, or all of them will be trait. So you can't predict chances. So the best thing you do is avoid it as much as possible, the ones that can't marry. So for the diagram on the right, those cannot marry because once you can see a sickle cell there produced as part of the offspring, it's not advisable. For the one on the left, they can marry because there is no sickle cell offspring. So we are trying as much as possible to eradicate sickle cell. To eradicate it, we ensure that there is no sickle cell offspring. So, slide map.
Okay, sir.
So what are the triggers of sickle cell crisis? Stress, physical stress or mental stress. After I talk about the triggers, I will now talk about what are the sickle cell crisis. So that is why you see, as much as possible, sickle cell warriors are advised not to stress themselves. You see some of them change job. Some of them, when they are preparing for exam, they go into crisis. Because with time, initially what we got to know was physical stress. But later on, we got to understand that mental stress can also cause it. And so anything like anxiety, depression, because sickle cell warriors also have mental problems. A lot of mental problems. Personally, I've experienced some mental problems when you go to the crisis, suicidal thoughts, you are tired of life. So mental stress can also trigger crisis. And one thing about mental stress is this: when the sickle cell warrior is having a crisis, as much as possible, you don't want to stress yourself mentally, because when you stress yourself mentally, it can worsen the crisis. So there are some things that you may do or you can do to help you take your mind away from the crisis, especially if it's not severe. Maybe a mild crisis, a mild pain crisis. You could get to do some things to take your mind off it. So as much as possible, for people with sickle cell, they are advised to ensure that they don't expose themselves to too much stress at work, at home. Don't expose yourself. So there's a threshold of stress that they can be exposed to or they can engage in. That doesn't mean it applies for all. Some, like me personally, I can undergo some stress more than some other people. And I've met some other sickle cell warriors that they can't even undergo stress at all. So it is important that each sickle cell warrior understand how his or her body works and be able to tailor his care towards how his or her body operates. So if you understand that at this particular threshold of stress, you develop crisis, you start avoiding those things that can trigger the crisis, or the kind of stress that can trigger the crisis. And there's this concept about premonition signs, whereby if at times or sometimes before the crisis occur, you have some premonitions that it will occur. At times you feel the chills. At times you go to the toilet frequently to urinate or defecate. At other times you feel just malaise, feel weakness. And then you just get to know that, oh, a crisis is coming or a crisis is about to happen. And at that point, what I do advise is, if you've gotten a premonition that a crisis is coming, try and identify what is stressing or triggering the crisis. And then, as much as possible, withdraw from that thing. So if you are engaged in a work that is stressful and you get a premonition that a crisis is coming, withdraw from the work for a while. Maybe you are in an environment and the environment is cold. So let me just go on with other triggers of crisis. Infestation, like any form of infection can trigger crisis. Why? Because these things will cause the red blood cells to be sickled. It will cause the normal structure of the red blood cells to become abnormal. So it becomes sickled. And once they cause the red blood cells to be sickled, the crisis occurs. So also dehydration, when there is low or reduced body fluid. That's why sickle cell warriors are advised to drink more water as much as possible, more than normal people drink regularly. You need to drink more water. Then extremes of temperature, either cold or hot. Initially, while I was in Nigeria, I always get crisis when I'm exposed to the cold weather. I didn't get to know that even hot weather could result to crisis until I got to Saudi Arabia. And at times I get exposed to temperature of 45 degrees and I just develop crisis. So that change in environment made me understand that, oh, even hot temperature can also trigger crisis. So within that period when the weather is cold, during winter, you see, we advise sickle cell as much as possible, put on warm clothes. That is then you advise them, because you see, at times you could see, I will say that sickle cell warriors, at times we could be very stubborn, because one, you don't understand why you tend to be different. Every other person during summer or every other person during winter, they can go out and play, or during snow, they can go out and play in the snow, but you can't try it. And as a child growing with sickle cell, you are seeing that and you are worried. Okay, you just want to go out and be like every other normal person, and you go out in the cold and you develop crisis, or you go back to sleep at night, and in the middle of the night, you develop crisis and you wake everybody up. See, I had experiences like that while I was growing up as a child. I grew up in Ilorin. My dad worked with the University of Ilorin then. So after lunch in the evening, my siblings and I go out to play football. And so I just go out to join them and play football. But at night, when everybody is sleeping, I wake up with crisis. Every other person does not wake up with crisis, but I'm the only one that wake up with crisis. And when I wake up with crisis, man, pain all through my body, from the crown of my head to the sole of my feet. I wake up with crisis and maybe 1 a.m., 2 a.m., and nobody can sleep again till 5 a.m., 6 a.m. So when my dad observed this, and he noticed that, oh, anytime I get exposed to this kind of stress, so what he did was, anytime he see me going to play football, he just, hey, go back inside. What are you going to do? that don't you know your body? You know, in Yoruba, you say, oh, Moware any. But your body is not like every other person. So that thing sticked on my mind that, see, is either you respect your body or you suffer the consequences. And then I took it upon myself to own my health and then decide I have to be proactive. I have to be pragmatic and ensure that I protect my health. Because when the crisis happen, when the crisis happen, at times it could be so bad that you prefer death than even God taking the crisis away. Because you are not assured that after this crisis goes away and that will not come. So is that bad? So from that depression, I can sort in. So because of such experiences, what you do is you advise, withdraw yourself from those things that can trigger the crisis. If the environment, so at times at work, if I'm at work and I discover that, oh, the AC is on and I'm getting too cold, I switch off the AC. People working with me, I made them, they understand that I'm sickle cell. And so once the AC is too cold for me, I switch it off and they understand. And so at that point, you see, I'm taking steps to ensure that I'm protecting my own health. And that is why we get to advise every sickle cell warrior and also their parents or their caregivers. Well, at times, some sickle cell warriors, when they don't understand their body, they want to enjoy the cold. Maybe they're just coming out from the sun, it's a sunny weather, and then they come inside and they just want to enjoy the AC. And then the AC keeps going, and then they stay under the AC for a while, and they don't really feel anything. But at night or later on in the evening, they start feeling crisis. Now, as their parents, when the child is doing that, the parents need to be observant and see that if this cold is getting too much, let them put off the AC. The child may not even voice out because he's just enjoying it. But as the person grows up, the person will understand his body. At times, some of those premonitions will come that, hey, you are feeling uneasy or you are feeling slight pain because of this cold, and then you change the environment or you switch off the AC. So another thing that could trigger crisis hypoxia, when there's reduced oxygen, there's this concept that once you climb, the higher you go, the lower the oxygen. And so most of the time, sickle cell warriors are advised not to leave high up the mountain. At the particular point, I worked in a hospital that was high the mountain, and within that period when I worked there, I was having crisis frequently. So I had that experience as well, though I had read about it then, but I never had an experience until I experienced it personally. So the higher you go for sickle cell warriors, the lower the oxygen. And then once there is low oxygen, the red blood cell shape changes to be abnormal and cause that sickle shape. And then the person can have crisis. So other things like acidosis. Now, acidosis is like increased acid in the body, in the cells. When there is dehydration, when there is stress, when there is infection or inflammation, it can also result in acidosis and other factors like that. So those are basically the triggers of sickle cell crisis. And then how do you prevent the crisis? Once you understand these triggers, you are, as much as possible, prevent exposure to it. So what are the sickle cell crises? There could be more, but basically what we got to know earlier were 4. Later on, we got to realize that, oh, there are even 5 or could be more than. But some people classify crisis different from complications. Now, that's why I want to classify like this. Hemolytic crisis is basically breakdown of red blood cells. The red blood cells are broken down. And so this is the reason why the number of hemoglobin or the hemoglobin count of sickle cell warriors is lower than for normal people. So, or the packed cell volume. If you want to know whether somebody is anemic, low blood level in the body, you do hemoglobin, you check the person's hemoglobin, or you do packed cell volume, and then it will show you the amount of the hemoglobin. Now, for every sickle cell warrior, for most sickle cell warriors, the hemoglobin count is lower. For average person, 12 and above, depending on the age and size. 12 and above is okay. Sickle cell warriors, you could see 10, 9. Even some, they are stable. So sickle cell warriors are advised to know their stable hemoglobin. For some sickle cell warriors, their stable hemoglobin is 7. So at times, parents get to know that their children are sickle cell when they are anemic. Maybe they go to the hospital and then they discover, oh, the child has an infection, the child has a sick, and they check the blood and discover that the blood level is low. and a doctor is curious, or maybe the child goes to the hospital for just anything, they don't even, it's not related to the blood, but they just do a complete blood count, and they discover that the blood level is low. For the child, the symptoms that the child is presenting, it does not correlate with low blood level. And so they are trying to curious what, and then they could order for an hemoglobin electrophoresis. And that's where they discover that the child is sickle cell. Now, because of the consistent breakdown of red blood cell, there is this notice, there's this observation that the stable hemoglobin for sickle cell warriors is lower than what it is for normal people. So sickle cell warriors are advised to know what their stable hemoglobin is. For some, at times mine could be 9 or 10. So if the healthcare worker does not know that the person is sickle cell, when you see a hemoglobin that is 9, oh, they want to transfuse. But for that sickle cell warrior, you can't transfuse because that is normal for him or her. And then another thing for sickle cell is that you cannot transfuse them with, whenever they need to be transfused, you should not transfuse them with blood that contains iron. Neither do they take blood tonic that contains iron. As I said earlier, hemoglobin is broken down into heme and globulin. Heme is the part that contains iron. Now, when heme is broken down, the iron is not discarded from the body, it's stored back into the body. So sickle cell warriors tend to have excess of iron. So when you are giving them more iron, they can result to iron overload, which will become another problem. So as much as possible, when sickle cell warriors need to take blood tonic or any hematinics or blood capsule, they should not take blood capsule or blood tonics or hematinics that contain iron. So that is what hemolytic crisis is. The crisis often occurs, their red blood cells are broken down frequently. So once red blood cells are broken down frequently, there is this protein in the hemoglobin called bilirubin, and that protein causes yellowing of the eyes. So when there is excess of bilirubin, the amount of bilirubin in the red blood cells increases because of the frequent breakdown of red blood cells. The sclera within the eyes of sickle cell warriors, you will see it yellow. So that's why at times you see that the eyes of sickle cell warriors are yellow. Whether they are sick or not, whether they are stressed or not, most of them, you see the eyes are consistently yellow. Now, at times, another premonition that could help you know that, hey, maybe this sickle cell warrior is having a crisis or about to have a crisis, that the sclera changes color from yellow to green. At that point, when it is green, there's excess, too much of bilirubin. So, and then another thing is when there's excess of bilirubin, you can also confirm from the urine. The urine of sickle cell warriors will be yellow. So most of the time, my urine is always yellow. And I've heard from most sickle cell warriors also that their urine is yellow. So and then I observe that when I drink a lot of water, my urine becomes colorless. So that is why it's often advised. There's this concept that when you drink too much when you drink more water frequently, it helps you flush off those abnormal or sickled red blood cells from the blood vessels. So that concept that it helps to flush it out prevents the yellowing color from the urine and then from the sclera. Then there's this, so from the hemolytic crisis, I also want to say that for sickle cell warriors, normally for the normal red blood cell, their lifespan is 120. But because of the abnormal shape of the red blood cell in sickle cell warriors, the lifespan of the red blood cell reduces to 60 or at times 10 to 20. So there is increase in red blood cell production because the lifespan is shortened as a result of the frequent breakdown. So once those triggers of crisis are there and the sickle cell warrior is exposed to it, there could be hemolytic crisis. Secondly, there could be vaso-occlusive crisis called the pain crisis. This is the most common or the commonest. And at times, this is when they get to know that some children are sickle cell warriors. It is that pain crisis. That pain is excruciating. I once wrote a poem about how to describe the pain crisis of sickle cell warrior. I just want to use three conditions to describe it. One, pregnancy, when a woman is in labor. Now, medical literature has been able to describe
Right, we seem to have lost Dr. Taiwo, but he will be back.
Yeah.
We know it's coming from all the way from Saudi Arabia. So we're going to give him some time.
So sorry.
That's okay. That's
okay. Sorry, the pain crisis. I want to use when a pregnant woman is term and in labor. I want to use it to describe the pain crisis. Thank God, most of some of viewers are women who have experienced labor before, so you'll be able to understand it. Now, from my understanding as a medical doctor, I will try and describe it better. Now, when a woman is in labor, there is latent, whereby the contractions are not frequent. Basically, when a woman is in labor, what happens is that there is contractions of the womb, uterine contractions. Now, there is the active labor, whereby the contractions are frequent. Within that period, the woman can have at least 3 or 4 contractions in 10 minutes. And each contractions could last for 2 minutes. That is when active labor is. And then the cervical dilatation is more than 1 centimeter. Now, that is how medicine describes active labor. Now, for sickle cell warriors, how do you correlate that with sickle cell vaso-occlusive crisis or the pain crisis? The pain a pregnant woman feels when she's in active labor, that is what you can describe. That is what some medical literature have been able to describe it. Now, in labor, when a woman is in active labor, it is like a crescendo decrescendo phenomenon, whereby there is a period of pain, and then the pain relaxes, the womb relaxes for a while, and then the pain continues. It picks up again, and then it comes down, the womb relaxes, and then contraction occurs again. Then whenever there's contraction, the pain starts again. So for sickle cell warriors, once the crisis starts, it doesn't come down. So a sickle cell warrior could have that pain-like experience for 5 minutes, for 30 minutes, for 4 hours, for a day, for 2 days, for a week, for 2 weeks, for a month. I have had pain crisis for like 2 weeks before. So that is how bad it is. And then because in the past, because people did not understand properly about this pain crisis, most deaths have occurred when sickle cell warriors had this pain crisis. It has been described also from some medical journals that pain crisis can result to neurogenic shock. Now, neurogenic shock is a shock that occurs due to pain. So for sickle cell warriors, that vaso-occlusive crisis is like what most of us experience frequently. I think it's the crisis I have experienced frequently myself. And so proper management of it, they need to understand how it is like. We need to make the public understand how the pain crisis is like. So that is one explanation using labor. Now, some medical journals have also said that the pain of sickle cell crisis is worse than that of labor. Some have described this as the pain of someone having bone cancer. Now, I will tend to agree with it because there was a time I had a crisis. I worked in a hospital then in Nigeria when the MD, unfortunately, the MD had a bone cancer. So he had to be using one of these most potent, I think it's like the most potent, or in the rank of the most potent analgesic in the world, petidine. So for someone that has bone cancer, if they are not using NSAIDs, non-steroidal anti-inflammatory drug, they get to use petidine when the pain becomes much, because it's like one of the most potent pain analgesic or pain reliever in the world. So I, through the pharmacy that was supplying it, I got it. I bought petidine and kept it because of crisis in case. Now, I've used pentazocine before, which later was not taking care of it, so I had to get petidine. So as God will have it, shortly after that period, I had a crisis, which I had to use petidine for. So that's when I got to observe that, oh, so this is what it is like when people who are having bone cancer had to use petidine, because no other pain reliever could just work. So for someone that has bone cancer, or someone that has a bone fracture, maybe a breakage of the bone due to accident, the way the person feels the pain within that period, that is how you also describe the vaso-occlusive crisis or pain crisis of sickle cell warrior. Now, for also an asthmatic patient who is having asthmatic attack, now, one of the things you could use to describe it is the gasping. When the person is gasping for breath, and then they need to nebulize the person. Now, one of the things you also experience during the pain crisis is that gasping. You are gasping for life. It's like each breath is like your last breath. So you are just gasping. And at times, I've observed people said it, and then I experienced it myself. When a woman is in labor, some people tell them, some midwives tell them, try and breathe in and breathe out so that it could help you ease the pain. And I've practiced this myself when I've been in pain crisis. And at times I've seen that it has helped to ease slightly the pain. So when I wrote the poem about how to describe sickle cell crisis, I pictured those three conditions: a woman in labor, and how it has helped to breathe in, breathe out to relieve the crisis, relieve the pain. Someone having bone cancer or bone fracture, and then someone having asthma, how it has related to pain crisis. So that's what I'm going to say about the pain crisis, because of time. So there's also the sequestration crisis, which is basically problem within the spleen. What the spleen does is that spleen is as one of the organ that subserve immunity, functions as the immune system for the body. So what it does is that it identifies the sickled red blood cell as abnormal, and then it mops it up from the system. So as it continues to mop, because as I told earlier, sickle cell warriors often have hemolytic crisis. So as they have hemolytic crisis frequently, the red blood cells become sickled. The spleen keeps mopping up these red blood cells. And then as it mops it up, it stores it within the spleen, and the spleen continues to enlarge until it becomes very big. And then it leads to a crisis called sequestration crisis. The person starts having pain on the left-hand side below where the heart is. That's where the spleen is. So it becomes enlarged. Now, there's this concept from medical literature that mostly from the age of 5 to 7 years, that sequestration crisis occurs. Now, it gets to a point whereby the spleen gets so large that suddenly it reduces, and it reduces drastically to even below the normal size. And then it becomes what we call asplenism or hyposplenism. In other words, the spleen goes through a process we call ectosplenectomy. Ectomy in medicine means cut. So the spleen automatically reduces, and then for sickle cell warriors, and then becomes short. So because the spleen has become reduced, the function is subserved, which is immunity, also gets compromised. So one of the reasons whereby sickle cell warriors often get sick is because the immune system is not functioning properly. One, the spleen. There are other factors also about the immune system that makes the immune system to function abnormally, or the immune system of sickle cell warriors to be considered low. So when you talk about conditions that causes low immunity in the body, like HIV/AIDS, cancer, chronic diseases, you also categorize sickle cell as part of them because of those factors. So at the age of 5 to 7 years, you observe that for some sickle cell warriors, when you check for the spleen, you don't find it because that's drastically reduced after that sequestration crisis to what we call ectosplenectomy. Now, there's the ablastic crisis. Ablastic crisis occurs, is a crisis in which all the blood cells in the body, remember I told us that the red blood cell, white blood cells, and then the platelet, all the blood cells in the body are affected. So there is reduced production of all the blood cells. Now, each one of these blood cells have functions they do in the body. Once there's reduced production, there will be complications or consequences due to that reduced production. Red blood cells transporting oxygen and nutrients, that function will be reduced. White blood cells that fight at immunity, that function will be reduced. Platelets that arrest bleeding, that function will be reduced. Now, cases of ablastic crisis has reduced because of better care among sickle cell warriors, but it's also a crisis they experience. And then there's this concept, initially it was not classified as a crisis, but some now classify it as crisis, called acute chest syndrome. Now, what happens is that the person can present as if he or she has pneumonia, or the person starts gasping for breath, and then the person has fever. Now, in sickle cell warriors, because of the frequent breakdown of red blood cell and high metabolism rate in the body, our temperature tend to be high for more than normal people. So at times you think, oh, the person has fever. It's not fever. It's just because of the high metabolism going on in the body. For sickle cell warriors, our temperature tends to be high. So in that period when someone has acute chest syndrome, the person, you may think the person has pneumonia because within that period there is breakdown of red blood cells. That sickled red blood cells is affecting red blood cells delivering oxygen to the lungs, And so the lungs is starved of oxygen because enough oxygen is not getting to the lungs due to the blockage of the blood vessels by the sickle red blood cells. And then that person start gasping for breath. The person start coughing as well. And because of high metabolic rate in the body, the person can have fever. You think the person has pneumonia. So at times, some health workers have confused it with pneumonia. Now, from some medical literature and experience, they do say that one of the giveaway signs that you could easily see, when you check the arterial oxygen level by doing arterial blood gas, you'll be able to detect that, oh, the oxygen is low. But before checking for that, in some places where they can't do that immediately, they tell to say that the giveaway sign is that when you check the sclera, you discover that it's yellow. It gives you an indication that this person may be sickle cell. Because normally when somebody has pneumonia, you don't expect the sclera to be yellow. But for sickle cell warriors that is having an acute chest syndrome, this classical presentation is like somebody having pneumonia.
Yellow.
So, in fact, at times when they do the chest X-ray, you may see some findings like pneumonia. But when you now check the sclera, you discover that the sclera is very yellow. That is give you an indication that, oh, there is breakdown of red blood cells, and then they quickly order for hemoglobin electrophoresis and discover that, oh, the person has sickle cell. So because of that poor management in the past, because of that not being able to detect it early, many people have died due to acute chest syndrome. I had a colleague, a senior colleague in medical school that unfortunately died from this experience also. So the point is, once people are educated about these things, they know how to attend to it properly and give the appropriate care.
Okay.
Sorry, I'm taking much time. So to the next slide,
Okay.
please.
Okay, sir.
So complications, I'll just try and pinpoint some of them. Delayed puberty, I experienced it as well, whereby when people are having those characteristics of puberty, you are not having it early enough. Maybe the person as a teenager, you start, normally for some people, they start having signs of puberty from 13, 14 years. For sickle cell warriors, at times, you're like 19, 20. So it gets so bad like that. In fact, I started getting beers or mustache when I was above 20. In fact, it got so bad that I was praying that I should start having it, but it was delayed. So later on in life, when I started reading about sickle cell, I got to understand that, oh, it is a function of delayed puberty. Now, medical science have not been able to trace categorically how it affects sickle cell. Some things they've been able to say is that because of the breakdown of red blood cell frequently not supplying nutrients to and oxygen to the brain, the hormones that takes care of puberty are affected, and then some other factors. But there is still more research that needs to be done to see how it causes delayed puberty in sickle cell warriors. Now, there's also this condition called dactylitis, hand and foot syndrome, whereby the arm and then the legs get swollen, the ankle and the wrist get swollen. This condition is also one of the conditions, especially in the past, whereby parents get to know that their children are sickle cell warriors. They get to the hospital, the child starts having swollen ankle and swollen wrist. And so they take the child with pain, severe pain. So they take the child to the hospital, and then by treating, the doctors order for hemoglobin electrophoresis and discover that the child has sickle cell. And that's when the parents get to know that, oh, this child has sickle cell. What is the parents' genotype? They don't know. They get to do their own genotype too. So that's one of the things that has helped people in the past to know that, oh, their own genotype, because when their children presented with that condition in the hospital, a doctor that has come in contact with that experience or knows about it, order for the test, and then discover that it is sickle cell that is causing a sickle cell disorder that is causing dactylitis. I remember my mom told me that I had the experience when I was 2 years old, and I was admitted, transfused with about 4 pints of blood. So it's something that is real in sickle cell warriors. Then priapism also. What's priapism? Priapism is painful, persistent, purposeless penile erection. Now, priapism, I also experienced it for a long while before it stopped. Now, priapism, medical literature will say it is not only sickle cell that can cause priapism. Leukemia can cause priapism. Injury can cause priapism. Some metabolic disorder, alcohol intake, liver disease, and a lot of stuff can cause priapism. But in sickle cell warriors, it's also caused sickle cell disorder, also called priapism, whereby the penis will just be erected, sorry, I'm saying I have to say it the way it is, because this condition I have observed. I belong to, as much as possible, I've been joining a lot of sickle cell community online, so that I can help other sickle cell warriors to understand about sickle cell. And I observed that most sickle cell warriors don't want to talk about their sickle cell experiences, complications. And then there was a particular time I had to post my story about priapism, and I discovered many sickle cell warriors were speaking out. In fact, some of them told me that they've been having priapism for months. I had never experienced it for months. The highest I experienced was for more than 24 hours. In fact, I thought I was going to need a surgery, but God just delivered me. Now, priapism, once medical defines that, once it gets beyond 4 hours, 2 hours or 4 hours, seek medical attention. And then there's this test, there's this procedure, exchange blood transfusion that is done to take care of priapism for sickle cell warriors. Unfortunately, I've had some sickle cell warriors say that they've had priapism for months, 6 months and the rest. So that is one of the complications of sickle cell. I had it also for some time before finally just stopped, and thank God stopped. There's also stroke. From the age of 5, 7 years, children, sickle cell warriors tend to have stroke. Why? Because sickle cell, the sickle red blood cell blocks blood vessels that supply blood to the brain. And so when there is reduced blood supply to the brain, oxygen to the brain, it results to stroke. Kidney problem, one of the first things is bedwetting, which I want to mention. NRS is bedwetting. I experienced bedwetting for a long while, till I think I was 10 years or 11 years. But it was later in life that I started reading about sickle cell that I now understood why. I was the only one in my family. I have 4 siblings, but I was the only one that was still bedwetting till that age. And I did not just understand why. So later on, when I started reading about sickle cell, that's when I now understood that, oh, so this is related to bedwetting. So I had to write about it on some platform for solar sickle cell warriors, and I observed that some parents had to come out that, oh, unfortunately, they didn't know that this is what is causing it, that their children have been bedwetting, sickle cell warriors have been bedwetting. Some have scolded them, some have stigmatized them, that if they had known, they would not have done that. So that is one of the areas why sickle cell warriors, we also need mental therapy and health to help them understand, because it could be really devastating. You are confused. Then in those days, I was like, what is going on? I had to be praying, God, I don't want to bedwet again. And I just woke up and I bedwetted again. And I just like, amongst my sleeping, I'm the only one. What is going on? And so I still see many children and caregivers talking about it, that, oh, their children are having this problem. So that's why it is important they need to be informed that, oh, when you see a child bedwetting and a sickle cell warrior, don't think it is because the child cannot control his or her bladder. No, sickle cell disorder is what is causing it. Now, there are other problems, hypostenuria, renal papilla, and even kidney failure. Sickle cell can result to kidney failure. So most of the time, once you prevent the triggers that causes the crisis, and then the sickle cell warriors take his or her medication that they should reduce the chances of some of these complications. Chronic leg ulcer. I also had chronic leg ulcer. Medicine defines a chronic ulcer as a ulcer that stays for more than 3 weeks or 6 weeks. The chronic leg ulcer, I had it in both legs. The first one was, I think, on the right leg, stayed for each one stayed for 6 months. In fact, when the first one happened, I thought I was going to amputate my leg because it was so devastating. I was treating the ulcer, I was treating the wound. It often occurs on the bony prominences, so you could sit on the ankle, the right or left ankle. Why? Because oxygen supply and nutrient supply there is insufficient. So whenever mistakenly you have a wound at that region, that wound does not heal, because wound needs oxygen and nutrients to heal. And so once the wound is starved from oxygen and nutrient, the ulcer will deteriorate, and then the person will have chronic leg ulcer. So I had it on both legs for 6 months. The first episode, 6 months. After, like some years later, another episode occurred. So when I had the second occurrence, and then I was dressing the hospital, in fact, at one point, the nurses that were dressing me were asking me, was it going to heal? And I was encouraging them that don't worry, it's going to heal, because I've had the experience before. But initially when it happened, I didn't know. Well, I thought it was not going to heal. I had to go for debridement, wound debridement, whereby debris within the wound, dead cells within the wound can be removed, because once there's a dead cell, the wound will never heal. At the particular point, I ought to also apply honey. So what I do is I encourage sickle cell warriors, if you are having chronic leg ulcer, go to a hospital, see your health practitioner, your doctor, physician, let them put you on a plan that can manage it. Don't manage it on yourself alone. Let them put you on a plan. You have to be dressing the wound frequently. If you need anything, they put you on the drugs you will need. So that's for chronic leg ulcer. There are so many other complications of sickle cell, which I may not be able to talk about because of time. So how do you care for sickle cell warriors? One, physical therapy, whereby you use drugs, pharmacological or non-pharmacological. Other things I will talk about, clinic. I don't tell sickle cell warriors or people to use drugs. I tell them, go to the clinic, go to the hospital, see your doctor and let them start you on your regular clinic and what drugs you should be using. Because ideally you're supposed to be doing some tests regularly to detect what drugs you should be using. At least the commonest drug that sickle cell warriors should know about is folic acid. Folic acid helps production of red blood cells. So apart from folic acid, there are other drugs, but as much as possible, they should attend the clinic whereby their doctor will place them on the drugs they need to be using routinely. And then when they need to see a specialist, preferably they can see an hematologist. Now, there is also need for mental care because sickle cell warriors experience depression, they can experience panic attack, anxiety, suicidal tendency. I've listened to many sickle cell warriors that say they are tired of life, they just want to die because of the pain. And so these are part of the things that they need for care. There's also need for social care, family support, funds to take care of managing sickle cell. I've had some people say it's like an investment on its own. There needs to be a social system that provides healthcare, employment, whereby discrimination, because there is this concept of discrimination, whereby sickle cell warriors are discriminated at work, discriminated in school, because absenteeism from work, absenteeism from school, a lot of those factors makes them discriminated. Even at home, among their family, some parents, I've had sickle cell warriors that say their parents discriminate and then the parents call them mistakes. Basically because they don't even understand what it is like. And some of them say their parents wish they are dead, that they just wish that they'll neglect them. So there is need for proper social care to be able to manage it. And then treatment, there is the cure, which is expensive, either bone marrow transplant or cell transplant, or there's the palliative treatment whereby you take your medication frequently when you go to the hospital. Because ideally, it is said, sickle cell disorder has no cure, but the cure that is available now in the world is more expensive, the bone marrow or stem cell transplant. Even after that transplant, you still need to be placed on some drugs. It's just like when someone has kidney or renal transplant, you still need to be placed on some drugs to maintain, and then you have to be able to detect which one is compatible for the transplant or not. So it has a lot of technicalities with it. But there are more researches that are going on to see how the gene mutation can be corrected, maybe by producing a vaccine or something like that. And then prevention of crisis, whereby you avoid the triggers of crisis, dehydration, extreme of temperature, stress, and then prevention of this sickle cell disorder, whereby genetic counseling and testing. That diagram I showed us, you advise couples before marrying that once you know about your genotype, let them know which one is preferable for marriage and which one is not preferable because of producing offspring with sickle cell. Okay, I think the next slide should be advice to sickle cell warriors and also their caregivers. As much as possible, avoid the sickle cell triggers. How? Drink enough fluid regularly and daily to prevent the crisis. Now, there's different advice about drinking fluid, which is water. But not only water. I've used myself to advise other sickle cell warriors, and I tell them, personally, I don't like drinking water, and I like a lot of sweet things. So what I do is I get juice, and I dilute it with water, maybe 50% water, 50% the juice, at least. So by doing that, what I do is that at least I can retain my sweetness for sweet drinks, and at the end of the day, still meet the requirement for my daily intake of water. So you need to teach sickle cell warriors and their caregivers to be able to identify what works for that sickle cell warrior, and then they should make that thing work for them. So if you know by diluting your water with juice will help you drink water, let them do it. Avoid extremes of temperature like cold or heat, avoid stress, prevent infections as much as possible. Now, because of my knowledge as in infection prevention and control, some people will tell you prophylactic anti-malaria for countries that have malaria, that are more prone to malaria, or other antibiotics. I will say, other than taking those things because of the problem of antimicrobial resistance globally, I will say hygiene and prevention. That's the best thing. Proper hygiene, hand washing when you need to do hand washing, when you cough etiquettes, cough hygiene, like I've been advised frequently due to COVID-19, environmental clean and all those factors can help you prevent infection. Now, another thing, regular visit to the clinic. They should be consistent with their clinic. Anytime they need to go for follow-up, they should go for follow-up. Whenever they are having problems, they should not wait for their follow-up. They should go to the clinic and then see their doctor. Vaccination as recommended. They are based on the country, the person or region the person is located. There are certain vaccines they should have. Now, the good thing about vaccination is vaccination prevents infection. So once you prevent infections from happening, there is no need for drugs. And then antimicrobial resistance is reduced. Now, also, the person should be compliant with his drugs as prescribed by competent physician. I've seen many people talk about a lot of drugs. As much as possible, I tell sickle cell warriors, don't use a drug because another sickle cell warrior told you to use it. Because each person's experience is different. Make sure your physician prescribe a drug. And that's how it works for medicine, generally, orthodox medicine. Don't use medicine because somebody says you should use it. Make sure your competent physician presents it, prescribes it. Then the last thing, be pragmatic to know what works for you as a sickle cell warrior and make that thing work for you. So that is the end. If you have questions, let me know. My references is taken from my book, A Life of Sickle Cell Warrior. I released it recently. From that book, I did a lot of wider reading and research. And then I was able to enumerate a lot of references scientifically from the book. You will see the references from different literature, WHO, CDC, from the book about different things. So even some of the things we did not talk about, like chronic fatigue and avascular necrosis, a lot of problems, you will see them in the book. So there are many things. I just want to say here that sickle cell warrior is a self-discovery journey. Sickle cell disorder is a self-discovery because medicine has not been able to understand so many things about sickle cell. There are some things that as sickle cell warriors, we discover ourselves. Briefly, I'll just use chronic fatigue to talk about it. The chronic fatigue, when I had to read about it from medical literature, was described like the chronic fatigue people with cancer or depression experience. At times, you just wake up. You know, people have asked me, oh, you are very energetic. And I tell them, I'm not always energetic. At times, I have this chronic fatigue and you just want to, you're just tired, you can't do anything. So at times, I get to sleep. I just wake up and I think I need to sleep, I need to rest more. And I spend maybe 2 or 3 hours to sleep. And I wake up and I feel weaker after waking up than before sleeping. So that's how chronic fatigue could make us feel at times. And so it was like a confusion because I didn't understand what was going on. After sleeping for 3-4 hours, I wake up and I still feel weaker. And I was like, what is going on? So I had to read about it and consult another sickle cell warrior. And the person described it exactly the way I was experiencing it. So it's more like a self-discovery. At the end of the way, so that's why it is important. There should be more research into sickle cell. Sickle cell warriors should speak out about sickle cell so that it can encourage qualitative research about sickle cell. Thank you very much.
Oh.
Wow. Thank you so much, Dr. David Owoya. I'm sitting here and my mind is, that was very, very, very informative. Just before you go, because I know there are some communication issues, there are some questions.
Okay.
We have 2 people with their hands up, but I would like to take one of our Facebook. Yeah. And the person, this is Dada Omodolakbo. Why do clinicians sometimes insist on transfusion of genotyped AA blood into a SCD patient? Does this have clinical importance?
Okay, let me explain it like this. The person, now for sickle cell warriors, if they need transfusion, the transfusion that they should get is from somebody that has AA. And I'm going to try and use what I would call common sense to define it. Now, the problem the person is having is because of sickled red blood cell. And the sickled red blood cell comes from somebody that has SS or has sickle cell. Now, if you want to remove the sickled red blood cells, you cannot put the blood of somebody that has sickled red blood cell as well. You understand it? So, because if you keep complicating the problem. So the best thing is, okay, it's like you want to remove dirty water. You cannot use dirty water to remove dirty water. You have to bring clean water to remove dirty water. So somebody has sickle cell and then is having complications because of excess of sickle cell, and you need to remove that excess of sickle cell. You cannot bring the blood, or you cannot transfer the person with the blood of someone that also has sickle cell, because you just be increasing the amount of the sickle cell in the person's blood.
Wow.
I hope it answers the question.
Okay.
That does. Thank you so much. And I'm sure the lady that asked on Facebook, I'm hoping that has answered your question. And we just got 2 more questions, and then we're going to go to the next guest speaker. So if I could ask Taiwo to unmute yourself and ask your question quickly, please.
Hi, thank you, Dr. Owe, for a very elaborate explanation. I have a brother who was SS and died at the age of 21. Not the same mother, same father. So by that, I established that my dad was AS. So my question is, by way of educating the community, does that mean that me, for example, I mean, I'm not married, never have been, should insist on having a genotype test if, say, I was to get married to someone who didn't know their genotype? That was the first question. The second question was just more to do with how we educate the community, because I understand the statistics and the probability of the selection process, but I know that not everybody does. And it was interesting hearing you at the beginning, because that made, sort of explain the way people misinterpret the probability randomness in the selection process. How do we go about educating the community at large on the probability associated with the genotype selection? Because that's the work that we need to do as a community. Thank you.
Okay, the first question, it's important everybody know their genotype, genotype. It's not even because you guys want to get married. One of the things that is being advocated is community outreach. Go to schools, it's better people know about their genotype right from childhood. So you see, even some people advocate now that during antenatal clinic, every woman, as they do some blood tests, it is important they also do their genotype test. Now, because they're already married, they may not know, but we have a lot of people that don't even know about their genotype. So even in schools, children, when you come in contact with children, I did a research on sickle cell when I was doing my master's, and the person, it was even MBA, but my supervisor wanted me to do something about health, so I did something about sickle cell. And I chose the University of Lagos, and I discovered that even people that we thought were educated, students don't know that much about, because some people thought sickle cell could be you could get sickle cell by infection, mosquito bite. So the point is, schools, let people be educated. So before you get married, there should be genetic counseling so that people can know about their genotype. In religious centers, because that is where most of the time information about marriage get to people in our community. And this is where people go through school institutions that allow them to prepare them for marriage, and then that's where people are joined together. So if that is going to happen within the religious centers, incorporate genotype testing into it. Because I know some religious centers have started incorporating HIV tests. So as you incorporate HIV tests, incorporate genotype testing, because it's also a problem. And then you want to advise them to prevent it. So you go to schools, religious organizations, companies, let people be aware about what sickle cell is. But the best thing is catch them young. When we move to children, go to children in their schools and you meet them, they can get to know about their genotype. Now, for the selection, how it is being inherited, the best thing is that diagram, because I have seen that even some health workers don't understand it, but that diagram will help you explain it better. Now, the issue is some people confuse it that if you're going to have 4 children, one will be this, one will be this. No, that's not how it is. if you are going to, for what happens is for each child, there is that probability. So assuming AS and AS, carrier, come together and marry each other. AS, what it will be like is 25% for each pregnancy. 25% will be AA, 25% will be SS, and 50% will be AS. Now, if the family has 3 children, they could be unfortunate that each child picks the chance of 25% SS, each child. So at the end of the day, that family could have 3 children with SS. I have met people like that, whereby just 3 children and all the 3 children are SS. And parents are just AS. So the concept is the chance. So that chance works, chance is by percentage, and you cannot predict chance. You can't say, okay, I have this belief that by chance the next one will be AA. No. Unfortunately, because you can't predict chance, the chance may still fall for all the children. The chance may still fall on SS or AS, or fortunately on A. So when you cannot predict chance, what should you do? Avoid it.
Awesome. Thank you so much. And Jacqueline, if you want to unmute yourself.
I hope it answers your question, both questions, sir.
Yes, but with the second one, sorry, guys, since he has a follow-up.
Okay.
I'm familiar with the probability and the statistics there myself. What I'm saying is in the community at large, because from what you said, it seems that there's a lot of misinterpretation going on. So what's your view as a public health consultant? How do we educate the community that this is a probability thing? Therefore, if as a couple there's only a 25% chance you want to avoid, how do we because there are going to be funding issues involved. I don't know, for example, if under the NHS genotype testing is available as a standard thing that you can do, for example, in the UK.
Okay, so to educate the community, especially about that selection, how it is inherited, you need to get somebody that understands it, because it is what you understand you can communicate to other people. If you don't understand it, you cause confusion. Once a person understands it, present it as a diagram. So you can organize community outreaches, maybe market women for some countries, whereby you could get people in the market, or go to a particular trade. People, so now we have people in different associations. Artisans have their associations. So you could target each group based on how they are available in the community, and then go to them, teach them about it. But the key speakers should be somebody that understands about how it is inherited and can explain it with diagrams and ensure that he or she communicates the right message. So in the community, you have schools. In the communities, we have religious organizations. You go to all these places. You can even have outreaches for companies. Come talk to a company, a private company, public company. We want to come and talk to you about sickle cell as part of their CSR, and they welcome you in. So you can target different institutions in the community. You can target different groups, associations, organizations in the community. All these structures are places where you can give education about sickle cell disorder. But it is very important, somebody that understands how to communicate it, understand and how to communicate it, should better communicate it so that people will not be confused.
Okay, brilliant. Okay, I'm going to go to Jacqueline now. You've had your hand up for a while. You want to ask?
Good evening, everybody. Thank you so much, Giz. Dr. David Oweye, beautiful presentation. I've been so engrossed with what you've been saying, and I hope one of these days I can have you on my program via phone, because I think that you put it so succinctly, especially as you also there's nothing like relating with something personally and people hearing from someone who is going through it. However, I just this is a disease that is peculiar to the Black race. And
yes,
because of this, I'm quite concerned that not enough is being done about finding succor, let's put it that way, because I mean, once a child is born with it, you know, it's something that one has to live with. But not enough effort is being put into finding succor, if not solution, to this problem. And this is because I feel like it is a Black thing. Now, for someone who lives in a place like Dubai, I'm sure you've been exposed to quite a lot, as seen as how you're a doctor and all of that. Do you think that we're going to see any sort of help in, you know, probably, I don't know right now? I mean, it could be anything, vaccines, medicines that are going to reduce the pain of warriors. Do you think that the advanced world, because when we're talking about research, Nigeria, let's not even go there, but do you think that there's hope that we will see this from developed nations? Or do you think that at the end of the day, Africa will have to look for, will have to push for Africa to actually take care of its own? I don't know if my question is clear. It's a Black problem. For any other thing, one would think that by now would have something apart from these very expensive procedures that could help, you know, a sickle cell warrior.
Okay. Yeah, I want to say, yeah, there is hope, and I pray it won't take a long time. But you see, the thing I want to say is this: the more we tend to speak out about it, we create awareness. Look at HIV. How did people get to know about HIV, and how did it get global attention? Look at coronavirus, COVID-19, because people started talking about it. One thing I've understood about global health is that the more people talk about it, and the more people talking about it, the more to get global attention. So that's why I always encourage, by forums like this, sickle cell warriors should start talking about it. I've had people, sickle cell warriors, tell me that they go to the hospital when they are in crisis, and the doctor is telling them they are faking the pain. Because, see, and I'm telling them, well, it's wrong that the doctor thinks they are faking the pain, but I'm a doctor as well, and the issue is, the reason why some of them may think you're faking the pain is because they're giving you some pain relievers, which they've given to other people that presented with pain, and we're shouting. For most of the time, sickle cell warriors, when they are in pain crisis, you don't see most of them shouting, because you are trying to conserve the energy as you are gasping for breath. So somebody has bone fracture, is shouting. They will rush the person with some pain relievers and it relieves it. But for sickle cell warriors, you give them those same pain relievers and they don't go. And the pain's still there. And the doctor says the person is not shouting, and they're like, you're just faking the pain. And you're requesting for stronger pain. Now, the reason is because they don't know. When you keep talking about it and let them understand how the pain is like, how sickle cell disorder is like, that is when people will see the need to commit resources, more resources, into developing better care for sickle cell. Look at cancer and, you know, myocardial infarction, other diseases, chronic liver disease, and all the rest, all of stroke, all of these diseases brought in the advent of MRI, CT scan, to be able to make proper diagnosis and treatment, because they were talking about it. Literatures were being written about it, people were talking about it. And so if we keep talking about sickle cell, writing literature about sickle cell, that's when we'll be able to get attention and then get better care. When I had to write that book, I had to do wider reading. And so I ensured that I detailed the references and some conditions that I wrote about, sickle cell complications. I discovered that there were little scientific information about it, that the world does not even understand how it works, like how bedwetting occurs, how pica is, sorry, I couldn't talk about it. Pica is eating inordinate things. As a sickle cell warrior, I was eating sand and chalk. It was when I was 20 years old that I stopped eating sand. But I could not control it. You get at it was like, you know, when somebody's like under compulsion. If you read that book, I try to describe it. I even wrote my experience about pica on the book, but before then I put it on some platform, sickle cell warriors, and I started hearing a lot of sickle cell warriors and their caregivers like, oh, coming out and speaking that Even I observe that my child eats ashes. My child eats ear. My child eats chalk. So this thing is called picker. So if I had not spoken about it, maybe people would not have known. And people would just have been beating their children. Are you demonic or what? But that thing, the way it controls you, after those days when I've finished eating and I'm full, I will never feel satisfied until I go out and eat sand. Okay, then within those days, pounded yam was one of my first best meal. We eat pounded yam Sunday evening and Sunday afternoon, and everybody is full and sleeping. But I'm full, but I'm not satisfied. And so I documented it in that book for people to understand how it feels like. I watch and observe my parents and siblings sleep off. So once they sleep off, because it's a shame for you to be eating sand. So I have to do it without anybody seeing me. So once I see they sleep off, I just go outside and I'll be roaming down the street to and fro like somebody that is mad, looking for where the sand is properly arranged and neatly arranged, and then pick it and eat. And after I've eaten, I will go back inside, and then that's when I will sleep. So that is like a compulsion. I had to, like, God, when I was 20 years, like, God, please just deliver me for this thing. And automatically it just stopped. So we need to get people to be talking more about it, because once you talk more about it, it gets more attention from more people. Once more people get to know about it, it will be able to get more funding, more resources from people. And we have to encourage sickle cell warriors to talk about it. And that talks about you not stigmatizing them, because once you stigmatize the sickle cell warrior, they just keep quiet. I can tell from my experience that I've had people ask me how sickle cell pain is like, and I just keep quiet, because if I'm trying to explain and you're not listening, I'll just keep quiet, especially when I'm having the pain. I'm trying to conserve the energy I have, and then I'm trying to tell you and you're not listening. I'm just like, I better get out. I'm trying to conserve energy to keep me alive. So sickle cell warrior, I believe you say sickle cell warrior will not talk to you, because it is difficult for them to get somebody that will listen. For you to talk about it, you yourself, you are confused about what you're experiencing. So you have to go to read. It maybe thank God that I am a medical doctor and I started reading about sickle cell right from medical school, so I can understand some things. So I'm trying to consider other people that are not medical doctors or in the medical line or healthcare line, and they're experiencing these things. How would they feel like? Because it will just be confusion. So the point is, let us keep talking about it. Once you talk about it more, it will be able to attract the government, attract the public attention, attract government attention, and then they'll be able to devote more resources to it. Even attract WHO attention. Because I remember for 2 years, when there is World Sickle Cell Day for June 19th. For 2 years now, when it was World Sickle Cell Day, WHO didn't mention anything about it. And I had to put a cap on, send a message to them that how come World Sickle Cell Day didn't mention anything about it. And then September is Sickle Cell Awareness Month. So apart from these days that are marked for sickle cell and months, people need to be talking. We need to encourage sickle cell warriors to be talking more about it. Once we keep talking about it, we'll be able to get more attention publicly and then get more resources to be able to. And then once we have resources, we can devote it. One of the areas we can devote resources into ensuring health insurance for sickle cell warriors, because I work in the health insurance sector in Nigeria for like 6 years before leaving Nigeria. And I observed that most health insurance companies, even up to now, are afraid of having a plan for sickle cell warriors because they don't understand it. They think it's going to be a big liability. And I tell them, you have plan for asthmatic patients, they have asthmatic attack, you have plan for them. And I explain to them that the same way it is for asthma, that's why it is when you have sickle cell crisis. So once you can prevent it, the crisis should not happen. So it's because of that ignorance, even where you have health workers, that ignorance is making them saying, no, we can't prepare a plan for sickle cell warriors under our health insurance. So more information, more talking about it, more campaign about it, more awareness about it will help it gain the kind of global attention and resources we need.
Brilliant. Awesome. Over to you, Yemi. Thank you so much, Doctor. Thank you.
You're welcome.
Wow. Thank you so much. You know, I could sit here for another hour, honestly, just hearing you talk. Because I have had close friends as well, and we did lose one as well many years ago to this same disease. So it has been something that has been on my mind for a long time too. One thing that we wanted to address also, but then you covered it, and I just wanted to point it out, was the how it then aggravates when somebody then is infected with COVID. And then when you mentioned acute chest syndrome crisis, I picked that up. That I mean, if you're having COVID the disease, and that then plays in, COVID on its own is a chest acute chest infection. So combined with somebody who has sickle cell and can also have acute chest syndrome crisis, and then pneumonia as well, and then the oh my goodness, I can't pronounce it, neuro something shock, all that.
Neurogenic shock.
Yeah, and all that with somebody who has COVID. It's just, do they stand a chance? Really? It's going to take a lot to pull out of that, because we are looking at a lot of Black African people who died during COVID. A whole lot in the UK were Black Africans, and I'm sure in America as well. And these are the complications that cause that. And even if you do not know that this patient has been brought into hospital, what they're looking at is COVID, but they're not actually even understanding that this person also has sickle cell or other diseases that then complicate it. So when you said that, it just made so much sense. And saying that people that it's not easy to diagnose. Oh, he's off. That it's not easy to diagnose this. It's amazing. Anyways, thank you so much, Doctor. We are going to move very quickly. We have Amaka Glorious. Amaka, please unveil yourself. Sister Amaka.
Yes. Yeah.
Hello, sis.
Hello, everyone. Before Doctor go, I want to ask Doctor, I know a family here in London, they are saying that they have a child with sickle cell, and they say they use supplement vitamin A and omega-3 from Neutralite. So I don't know, because I used to join meeting with them. So I don't know how if that will help. I want to ask Doctor, does it really help? Supplement, plant-based supplement. I know a family, they say what their child uses is plant-based supplements, vitamin A and the omega-3 with Neutralite. So I don't know what Doctor will say about that.
Okay, I practice orthodox medicine.
Yeah.
So I can only talk from the angle of orthodox medicine.
Yeah, okay.
I can't advise about that, because I tell people, you know, I want to use COVID-19 to describe this. When COVID-19 started, you know, many people said they've discovered the cure for COVID-19. And then WHO was debunking some of those information that there's no cure. And some people were saying ginger, garlic, and a lot of those. As a doctor, I want to say this. Now, if whatever method you are using to treat and cure sickle cell can also help us detect sickle cell, then I will say, okay, I believe. I want to be assured that it's correct. Just like COVID-19, somebody is saying he has a cure for COVID-19 based on the method he or she is using, but this method cannot detect COVID-19. So how can you tell me you can solve a problem you cannot detect? That's my explanation for such things. Now, because I'm an orthodox medicine, I may not be able to talk about that. But if your doctor prescribes it for you, because I've seen some doctors, there are doctors also the traditional medicine, which are licensed. Most of those herbal stuff that are licensed by regulatory bodies. If they are licensed and they prescribe it and it works, you know, as I said, understand what works for you and make it work for you. If it is, fine. But if not, don't use it because somebody told you. Make sure your doctor knows about it and then recommend it. Okay. That's what I can advise.
Okay.
Because, sorry, I tell sickle cell warriors, you are not guinea pig. Some people are out there to just market whatever they want to sell and make profit, and then they disappear.
Yeah. Thank you so much for the answer. So, guys, today I'm doing some nutrition course, and I've studied. I try to do things that will help because with sickle cell, doctor have said it
You're
all.
welcome.
He's experienced, is in it, and he has gone through some stages. So while studying, I noticed that they need to eat, especially food and vegetable things that will make them to the blood flow, so that they, instead of to avoid those crises. And then I normally tell people green. At times, you know, anything you can see in your fruit have rainbow, and then your vegetable have green, and plus other nutrition food like beans, fish, meat, red meat that will give zinc and other things. So today I'm going to quickly show green veg that I will do like a smoothie that will help the blood flow. It will help the blood flow, because most of our people, they don't know, like our Black community, they don't know that Kelly leaf is so important, because this will help you to the blood flow. I have Kelly leaf here. I've watched them. I have spinach. Spinach is very, very good. It's very good. Doctor can testify to that. So, and I have avocado. This is organic fat. It gives good fat. And I have kiwi. I've all dyes it. I have kiwi, and I have cucumber, and I added banana. All the things I have here, this will help you, because most times if we try to manage it, it's hereditary, but we'll try to manage it to, you know, to avoid those crises. So all this I have here, I'm going to quickly show you how I'm going to mix them up and get a smoothie that will help anyone, any family, any child. Just the family should incorporate this, all green, or do make sure there is rainbow. Their fruits are rainbow, eating a certain rainbow fruit. But most times, you know, because of what we are, like we that is in Europe, is very hard because of chemicals. That's why that family was saying about they incorporate both supplements, knowing that that company is a plant-based supplement. So today I'm going to blend this together to get a smoothie. So if this will help that family, will help that person that is undergoing this crisis. They can't kill themselves. If you find yourself in this situation, you didn't create yourself. God just made it. You came out and this happened. Doctor has explained everything, the chromosome and everything. So it's just for us to manage it well. So today I'm going to mix all this together and get a smoothie that will help to increase the blood flow, that will help and prevent the cell damage. Because like now, while you are taking this for adults, you still take green tea. I've seen in studies they take green tea. Green tea is good, but just avoid sugar. That green tea will also help to prevent your cell damage, because it got antioxidants. So I'm going to blend Kelly and spinach, all washed. I've washed them, and the cucumber, all washed. I've washed them, and the kiwi. And this is all, if we can do, even for us, even if you're not a carrier, and if you do all these things, it's good. It's help us, especially we that is in Europe, that we are not getting that organic. So we try to incorporate greenie. This will help that child, that person that is that has sickle cell, to fight that, to live longer, fight that disease, and it will help you to your blood flow. So I'll add banana, knowing that banana is also good. So I'll add banana, and then I will blend it together. I'll blend it together and get a smoothie. So I'll add water. So this is a quick one. This is good. It will help you. It will help the blood flow. So sorry, my children are not here. I'm struggling with the camera. So Oh.
Looks like we're watching a smoothie that we're not going to drink out of. Giz, I suppose you and I are going to do this. Unmute yourself, babes, please. I do one. I do cucumber, lemon, cucumber, lemon, parsley, flat leaves, cucumber, lemon, parsley, flat leaves, and I blend it. I think I have that twice a week.
Okay.
Yeah, I
So
hate it, but I drink it.
This one now is for those people who have sickle cells. Is that what we're saying?
Yes, it's supposed to
Yes,
support
yes.
the flow of blood.
Right.
Yes, yes. Sorry, I'm managing with the camera.
No, that's
They're not
fine.
All right.
So this is very good. Doctor, what do you say about this? This is very good. They can take
Doctor
this.
says he
to help
cannot
them.
recommend
Okay,
you.
it's okay. It's okay as long as natural
Really?
work.
So this will help with all I have here. It will help you to prevent those your cell damage. Green tea is good. Just take green tea always. It has antioxidant and to help to prevent the cell damage. Then for a child, the child needs more zinc, so that they will grow maybe tall. Some children, it will affect them maybe growing tall or adding weight. So they need more red meat, beans, more egg and everything. But for adults, we need all the dry, like the beans, any kind of beans, any kind of green veggie like this, green tonic like this. They call it tonic, where you have your cabbage, you can mix anything. You have your okra. Okra is very excellent in it. You can add okra. They eat beetroot, is very good. All this will help the blood flow, because you don't want to, that crisis is what we're running away from. So you do this will help the blood to flow. And you will limit those crises. Because like now, the egg is another thing that is good, because you need what have a plenty of calcium. All the food that has plenty of calcium, omega-3, all is good. That's why that family, I was in the meeting with them. They say they do all this. They eat all greeny, and they incorporate that supplement that he helped the child.
Okay. I think that's what doctor said, Sister Maka, that what might work for that child might not work for another child. But if it works for that child and it's preventing, because if he focused on prevention as well, if it works for that child, then they're probably then achieving.
So this is all I have to quickly show today. This will help you. Someone that is going through that, this greenie will help. This greenie is very good. Even I introduce it to my children. They take it.
Please, if I can quickly chip in here.
Yes, go ahead.
Folic acid is very good for everyone, but I think Dr. too will agree that it is needful for sickle cell warriors. But like I said, for everybody, in fact, women who are intending on getting pregnant, or even those who are pregnant already. And
yes, it's true. I mentioned that folic acid is one of the drugs sickle cell warriors take every day.
Right. So, and I know that leafy green, from ugu to spinach to, I don't know this Kelly that Amaka was showing us, but
it's very English, Jackie.
Okay, sorry.
It's very English.
Okay, so I think this is beautiful, even for just about anyone. This would be really nice. Yes.
Thank you so much, Sister Maka. Thank you.
God bless you.
Please, please, can you list the ingredients, everything you've put in there? Drop it on our page, please, so that people watching, and also put a link for your Instagram and your YouTube page. I've subscribed because I follow you.
Once you type Amaka Glorious, doctor, I do natural remedy. Once you type Amaka Glorious, you see me. Okay.
Amaka, go.
So, so I tried to, I'm not a doctor, I'm not a nurse, but I tried to study, I tried to research, I look at what people has done, the content, because I started YouTube during lockdown. I look at what people has done. I'm doing my nutrition now. I look at what people has done and I research and I come up with my own. And I've got a lot of questions. Not that I'm not a doctor, they still ask me about family, man, woman. I still answer. I still come up, research and come up with that. So it's just...
Thank you so much. Well done. So much. God bless you and God increase you. Doctor, thank you so much. You know, we need to have you back on the program. Jacqueline is in Kaduna and she's the director for programs at Invicta Radio, and I am very sure she will be grabbing you. So it would be lovely to see you back and hear you.
No problem.
I'll be getting his details, please.
I know you
No
will.
problem.
Awesome.
Thank you so much, everyone who's joining. Giz, over to you, darling.
Okay, thank you. This has just been such an amazing session. Dr. Owoye, thank you so much. All the way from
You're
Saudi
welcome.
Arabia. We are so grateful, and we definitely will be having you back on the program in the future. Sister Amaka, thank you so much. That looked amazing. Please, please, please drop the ingredients. We will definitely be trying out that smoothie
I will.
Thank you
God
so
bless.
much. I just want to say thank you to all our regulars, Jackie, Mercy.
Marcia, she's had to leave.
Okay.
Yeah.
And those that were
Who's
on
Mercy?
Marcia. Mercy, are you there? Okay.
Say hello.
Say hi if you're there. Okay. We've got Taiwo. Taiwo had to leave because he had a phone call. But thank you, Taiwo, for coming on. And we have a distinguished guest all the way from Rwanda. Unmute. I'd like to ask you to unmute yourself. This is Kelechi, Mr. Kelechi Anyanwu, all the way from Rwanda. Thank you so much for joining in today. It's a pleasure. You might need to unmute yourself so we can hear your beautiful
Can we just hear you
voice.
speak for a minute?
Yeah? Are you able to speak? We can't hear you. We can't hear you. Maybe you need to unmute.
He has. It's just the volume's playing up.
Maybe the volume. Okay. Yeah, it's possibly the volume. Okay, that's fine. Thank you so much, all the way from Rwanda. We appreciate you. And this is from XL Plus, is Mr. Anyanwu's company. So yes, we hope that this was informative for you, and it would have been nice to hear how, because you see, I think it was Jackie who raised, no, it wasn't, it was Taiwo who raised the question, how can we educate, the community? Now we know this is something that is predominant in the Black and African community. So how do you deal with this in places like Rwanda? What's the support out there? In Nigeria, what is the support out there? Are there workshops that create awareness? Because as Doctor said, it's okay if we have this Zoom today, we go away, we need to still keep talking about sickle cells. There are some things that the picker, I think that's what he called it, the picker, that threw me. You see children eating sand and you think they're demonic or they're possessed. We've now been given an explanation as to why, or the reason why they could possibly be doing this. So guys, this is why Saffron does what Saffron does. We want to raise awareness. We want to impact in communities around the globe, especially within the African and the Black communities. So thank you for everybody. Thank you, Kelechi. And we hope that this is your first time on our Zoom. So thank you and welcome. We hope you join in subsequent ones and we get to talk to you. So sort out your volume. Okay, thank you so much to everybody. And thank you, Facebook. Thank you so much, our Facebook family, because you're always there. You're always watching. You're always supporting us. You're always asking questions. And, we hope that today especially, there have been some unanswered questions answered by having the doctor on and by having Amaka on, who has shown you briefly, something you can do on the go for your children. And what we will try to do is to put as much of this information as possible on our page, so that even after now, you can still go back to the page, and feel free to drop any question on the page. And what we will try and do is pass those questions over to the doctor, who in his own time will answer, and then we can get back to you. That's what we do. It's not just you come here and you go. We are, like we've always said, we will support you, we will guide you, we will advise you. And if it's not in our remit, this is why we call in the professionals, because you can see from what Dr. David Owoye said, his book. So he has done extensive research. So this is not just off the head or off the cuff information. This is basic, in-depth research. So we hope it was informative. We hope you gained something from it. And we are grateful to have you guys on, because without you guys, you know, there's no Zoom. So thank you so much. On behalf of the whole directors from Saffron Seca UK.
SDGF2 was
thank
up.
you. On behalf of our mother company, which is SDGF, Saffron Development Global Foundation, Nigeria. We are based in Lekki. We want to say thank you. And we do want to say a quick shout out to Saffron Seca, because guess what, guys? We're 1 year. We will be celebrating properly. Yeah, we will. We've clocked 1 year. Yeah, I know. We're going to do a big celebration. Thank you, guys. Thank you. No, but on a serious note, we say thank you to each and every one of you. Those of you who come on a regular every week. Those of you who are on Facebook, you know, and all this does, it makes us want to do more. You know, we are going to impact on the community. We are going to make our country, Nigeria, a better place. We are going to impact on the Black and the African community within the United Kingdom. Okay. And we're going to come to Rwanda, Kelechi, so get ready for us. We're on our way. You're waiting. Okay. So thank you so much to everybody. It's 8:15 now, and I'm sure everybody's dinner must have run cold. So please, please stay safe out there, guys. It's not a joke. COVID is real.
Yes.
We just lost somebody. I want to shout out, a big shout out to my classmate who sadly passed last month due to COVID. We found out yesterday. It was a big shock to everybody, but may her soul rest in peace. It's real, and sometimes it's hitting close to home. So please stay safe, follow the guidelines, you know, do what the government says, because there's sometimes sense in some of the madness, you know. So just please stay safe. And we hope to see you next week, Wednesday, because we will be back. We ain't going anywhere. All right. Have a good evening. God bless. Bye-bye.
Bye-bye. Thank you, everyone. God bless.
Bye, everyone.
Thank you.
Bye.
Thank you, his man Cobain, for joining us. Oyewale, thank you. Thank you, Mummy, Alice. Thank you, everyone. God bless.
Thank you, guys. Thank you. Bye.
Bye-bye.